Hello, this is Dr. Lewerenz at Longevity Health Institute here in my laboratory in Rochester Hills at the end of the day. And I want to speak with you about something that just came out in a big study. It was just out there in the media. I'm sure you've heard about some of this, about blood pressure reduction and when to take your blood pressure pills and why and how. And the reduction in cardiac events, stroke and heart attack, are drastically reduced by doing this one step when you're on a blood pressure medicine and taking it this way. I'm going to share with you that at the end of the video, and I'm going to give you a few simple steps that always help reduce blood pressure, okay? Obvious ones: if you smoke, you got to quit smoking. If you excessively use caffeine, that actually is a big influence on vascular stiffness and hypertension, your autonomic response, so reduce your caffeine. Lose weight and exercise. Of course, lifestyle things are very impactful in reducing blood pressure, okay? Anytime you do anything, and we have a 6-point model here at Longevity Health Institute that focuses on this. It's a health foundational model that we practice here, a functional personalized model. But anytime you use a model like this or just doing anything in reducing inflammation in your body, typically your blood pressure will reduce. Inflammation, okay, is the root of all disease. If we can reduce inflammation in any way, this can be measured in your blood by highly sensitive CRP or even your ESR, your SED rate. But highly sensitive CRP is a big indicator of inflammation in the body. Anything you can do to reduce inflammation, typically blood pressure will come down a bit, okay? But lose weight, diet, lifestyle, exercise, de-stress. Meditation is huge. Meditation has been proven in multiple studies that it reduces blood pressure by up to 10 points, okay, depending on the study. But if you're stressed, meditation can really help, okay? On a supplement end, there's many supplements that actually can help reduce blood pressure. There usually isn't one fix. You have to fix the underlying cause and root issue. Again, we focus on a foundational model for blood pressure, like looking at genetics, looking at hormones, diet, gut health. Do you detoxify? Which all of these diet, gut, hormones reduce inflammation when you get them balanced. Stress and lifestyle, pain. Pain alone can raise blood pressure. So in the system of pain and structural issues, you do have to pay attention to that, because sometimes that can be overlooked. Somebody in pain, acute pain or chronic pain, is going to have elevated diastolic, that bottom number, blood pressure, okay? But here's a few tips that always can help. Magnesium glycinate, malate, chelated forms are the best. I can even give you a site here in the second where you can get these on our website, on our supplement shop. But magnesium glycinate or malate are the ones that I like to use that actually can reduce arterial stiffness, so they relax your body. I find it very impactful to make sure that somebody is not on a supplement, and this is really key. Usually this is men, that is blocking too much estrogen. Estrogen is a vascular relaxer. So if you're somebody on hormones, or you're using a supplement to get trim and cut, you actually may be on a supplement that actually reduces your estrogen in your body as a man, because that will get you cut and lose weight, yet it can make your blood pressure go up. So be careful about that. Other supplements that actually can help reduce blood pressure are anything that induces an increase in nitric oxide release. So there's a supplement on the market called Arterial Sil. I love it. It's kind of expensive, but it actually has this glycocalyx effect where it helps you release nitric oxide from these little hairs in your arterioles and your capillaries, and that can reduce blood pressure. Any type of beet extract or beet supplement actually has a nitric oxide effect. A few amino acids, L-citrulline and L-arginine, can actually help reduce blood pressure by increasing nitric oxide. Yet you do have to be careful with these, because you have to take them in ratio with people with herpes or shingles history, because too much arginine and citrulline can actually stimulate or feed a herpetic or shingle virus. So you have to use lysine and get some balances there. So talk to your practitioner about that if you do have that history. There are some herbs like hawthorn berry that actually can reduce blood pressure. Omega-3s actually can reduce blood pressure a little bit. Also aged garlic extracts actually can reduce blood pressure a bit. Now again, what we find here at Longevity Health Institute is we do a systematic approach to treating your functional systems, solving your goals, and getting you well, and then we'll see blood pressure drop. Probably the first knee-jerk supplement we use is the magnesium, often a little bit of omega-3s or fish oil. I love to tell people to encourage them to eat beets, get a beet extract. There's one called Neo 40 you can actually use. Anything that's going to help increase nitric oxide is always beneficial, okay? And that estrogen thing about not too low of estrogen, especially in men, is a negative thing for sure, okay? But again, lifestyle is typically the best. Now, this is the study that came out. Over 19,000 people studied if you're on a medication for blood pressure. And this is very, very interesting because this has never been proven. It has not really ever been really looked at in detail. But if you take your blood pressure medication, if you're on a blood pressure medication, and you should stay on it, okay, regardless of the type of blood pressure medication, you can reduce cardiac events, cardiovascular events, stroke events, etc., by huge amount, over close to 80% if you take your medication at night, at bedtime. So set your phone, set your alarm. If you brush your teeth at night, if you have a routine you do at night, maybe you meditate, relax, etc., take your blood pressure medication at night. Obviously, if you take it twice a day, continue to take it at night and in the morning. But you can reduce drastically your events of blood pressure and cardiac events throughout the day by just switching to a night dose of your blood pressure medication. Now, talk to your practitioners about this, but it's a very, very well endorsed study. 19,000 people, endorsed by the let me start over with that again. The American Medical Association. Got to laugh at myself about that one. Got a little tongue twisted, but it's very reproducible. And so I think this makes sense because we do see a lot of heart attacks and strokes and autonomic stimulus responses in the morning. Your blood pressure, you wake up, a lot going on, you get out of bed, etc. You induce a lot of endorphins, and blood pressure and autonomic stuff can go on, which is like higher heart rates, higher blood pressure. So it makes sense to take your blood pressure at night. But again, talk to your own practitioner. We've started to incorporate this in the office. Our goal is usually to get you well, get you balanced, reduce medications if all possible, use supplements, use natural approaches, okay? But that's always going to come with lifestyle, diet, exercise, weight reduction, which we help you with all these. So hopefully this is enlightening. You can look up that study. The supplements I mentioned and all of our supplements you can get on our website, longevityhealthinstituteinc.com. There's a supplement shop. Go in there. The password is HEALTH, HEALTH. We do free ship. Any order is over $100. We have the best medical grade supplements. The things I mentioned on here, obviously always talk to your practitioners and or your holistic physician and a practitioner, or your medical doctor, or us, and we can guide you a bit. But anyway, they are the medical grade GMP high standard supplements on the market. So again, Dr. Lewerenz, Longevity Health Institute. Take your blood pressure medication at night. Change your lifestyle. Reduce inflammation. Okay. See a functional, personalized medical practitioner, and they should help you with all this model. And we're always open and accepting new patients to help you, me and my practitioners. So hopefully we see you, and hopefully this starts you on a health and wellness course to reduce blood pressure and get some better results. Be well, Dr. Lewerenz.